The National Coalition for Cancer Survivorship advocates for quality cancer care for everyone touched by cancer. Founded by and for cancer survivors, NCCS defines someone as a cancer survivor from the time of diagnosis and represents the millions of Americans who share a common experience, living with, through, and beyond a cancer diagnosis. In Cancer Convos, NCCS talks with survivors, advocates, caregivers, providers, and health policy experts about survivorship advocacy and public policy. For more information about NCCS, visit our website at canceradvocacy.org.
Hello, I'm Shelley Fold-Nasso, CEO of the National Coalition for Cancer Survivorship. I'm honored today to talk with Veronika Panayiotou, a cancer survivor and incredible advocate. Veronika attended NCCS Virtual CPAT Symposium and Hill Week in June, and she met with her members of Congress to talk about the need for paid leave for cancer survivors who are at high risk for COVID-19. Veronika, you did a fantastic job of sharing your story and why paid leave is important to you, and we're thrilled to have you as a guest today.
Thank you, Shelley, for having me today.
So first, can you just tell us a little bit about your background and your cancer story?
Absolutely. So 7 years ago, I celebrated my 25th birthday and was diagnosed with non-Hodgkin's lymphoma, a cancer of the immune system, in my local ER. And I arrived there very sick and without health insurance at that moment. I asked them in the moment when they told me that I had cancer, I didn't ask about a treatment plan or what the next steps would be. I asked, will you treat me without insurance? And they did. And 7 years later, I'm here and honored to be able to share this story. In January of 2014, the Affordable Care Act gave me access to treatment that saved my life. And today, COVID has really made me truly vulnerable again. I have spent the last 120 so days at home isolating because I fear COVID. I fear that my immune system cannot protect me. So that is where I am today.
So tell me a little bit about your job and what it was like before the pandemic for you been home furloughed and isolating.
So I work in a cultural institution in Pittsburgh in a museum. I work in the visitor services department, and my main responsibility is to interact with visitors, with the children of Pittsburgh, providing them with educational opportunities, taking them around the museum, providing support to frontline staff to be able to take care of the needs of our guests. So I've been doing that for 3 or 4 years now. I'm also lucky enough to be a college instructor in a local university as well. My love of education, my story, I realized throughout my education that I really wanted to work with children, but the school environment isn't very conducive to someone with a very poor immune system. I've learned that over and over again, trying to work in schools, that I just get sick too often. And so being at the museum, being in a non-traditional education environment and working with college students who are able to manage their germs in that close proximity. But really, that's all gone out the window at this point because young adults are spiking in COVID at the moment. And my museum is not deemed essential in Pennsylvania. And so it's actually not open. And my work is with visitors. So working at home is not an option. And so I've actually been furloughed from the museum while they try to figure out how best to open the museum and allow for the creativity and the joy and the exploration that's so fantastic within a children's museum.
Right. And I've been to that museum. It's a pretty amazing museum.
It is truly, I work there for the joy that it truly brings to me, even as an employee, to be around the creative souls and the artists who work there and the guests and the kids who come in. I am part of a team that welcomed more than 10,000 school children into the museum for field trips last year and being part of that team. And I miss it. Your job is your identity, and I want to be there so badly. I want to be able to function in this new normal, but I don't know if that's possible. I have to figure, we all have to, I think cancer survivors are so good at adapting to new environments. That's basically what we do now. And so I know that we can figure it out. I know that we can figure out how to function, but we might need help. We might need help to be able to figure that out.
Well, and I've thought for a long time that since this pandemic started, that something about the cancer experience really makes people more resilient and adaptable, and has prepares people for this in a strange way, because you've had to, like you said, be flexible and adapt, and things change, and your life changed when you were diagnosed with cancer. So you've already been through this before, kind of figuring out how to adapt to a new reality.
Yeah, I spent the 6 months of treatment actually isolated in my home. So I've done this before. And it actually, the second time around, it's not so pleasant. It brings back a lot of memories that as a cancer survivor, I thought I triumphed, right? We use a lot of big action, courage type words to describe how we get through our journeys. And it's still devastating 7 years later, thinking about that period where I was finishing up my master's at the University of Pittsburgh, and I had a plan, and I knew where I was going to, what my job goals were, and I knew where I wanted to fit in, and it's all changed. It's a completely different 7 years. I wouldn't change it, but it's different. It's not what I had planned at all. I'm almost done with a PhD 7 years later. I never thought that I would get there, but I have, and I'm super excited to be done with it too.
That's wonderful.
We all do what we have to do to be happy also. That's important. I want to be happy in these years that I fought so hard for.
Right. And it sounds like your job at the Children's Museum really gave you that ability to be an educator and to help children with a better, I guess, safety for yourself and your immune system than being in a classroom.
It did. I did also the bad thing that sometimes I think survivors do, where we want to jump back in. And I did work in a child development center for 2 years, thinking that it was mind over matter, that if I wanted to be there, then my immune system was going to cooperate. I wanted to work with the itty bitty babies and the toddlers. And it took 2 years to realize that sometimes we just can't do what we planned on.
Yeah. It's not always mind over matter. There's science involved sometimes. And if your immune system is not what it was, then you have to, yeah. So now that the pandemic has impacted your job, or you've been furloughed for almost 4 months now, how are you getting by? Do you have anything protecting you, like helping you pay the bills and accessing health insurance? I mean, that's a long time. And I think the other thing that's really important about your story is, so often, people think about people being able to work from home during this time. And I'm very grateful that I can work from home, and that we at NCCS have been continuing our work, all working virtually. But you're proof that not every job allows for that, and that we need to be able to take care of people even if they don't have that as an option. And not that working from home is easy, because it's definitely got its own challenges, but for some people, that's just not an option.
Yes, it's definitely, there are some jobs that can't be replicated at home, but also you don't need as many people. So the museum still has employees who are working from home. They're trying to offer virtual summer camps, and staff are taking care of that. But you don't need as many employees to work from home as well. So we tried, all of us trying to work from home, but we don't have visitors, and that's that's to pay us off, right? So the protections. So as a cancer survivor, we always are making backup plans. We always have plans. What do we do in the worst case scenario? And so we all sacrifice for those plans. So as a 31-year-old, I live with my family, with my mom and my brother and sister for this sole reason. If there was a time, either a relapse, which I've had 2 scares that way, I've had other medical complications because of comorbidities that are so common with cancer, I've created a safety net. So I sacrifice being independent and living on my own and jumping from job to job like some people do to accelerate their careers. They take risks. Those are not possible for me because I just can't take the risk that I initially took 7 years ago with not having health insurance also. It's a lesson that is ingrained in me that I can't be in that situation again. I don't want to be in that situation again. It's funny you bring up health insurance because my health insurance actually runs out on July 31st. So I'm currently in that situation again, but I won't make the mistake this time of saying I don't need it. I will ultimately go back to the marketplace. The Affordable Care Act will contribute to my positive health and will be that safety net that it was supposed to be.
But Cobra is very expensive too, so I guess you'll have to look at your options.
Mm-hmm. I'm lucky to have created a safety net where Cobra is still an option for me
Hmm.
because I never wanted to be in the situation where I couldn't afford it.
Right.
So in my mind, the healthcare cost is like the Disney vacation fund. It's always there for the big one-time expense and joy is my having health insurance. I equate it to going to Disney World. That's how important it is to me to be able to have it.
It is important, but it's not quite as fun as Disney World. So it's too bad that you have to, give up Disney World to make sure that you can have health insurance.
Health insurance, you don't know how valuable it is until you don't have it.
Hmm.
It's not just you're able to have access to health insurance or being able to afford your deductible or, having more access to treatment options because you have this health insurance. There was so much stigma around how could you not have health insurance that was more troubling to me than getting the $300,000 chemo prescription cost in the mail and seeing the zeros and zeros and knowing that I had bought 2 houses for my one cancer treatment in exchange. That's how I looked at it. I could buy 2 houses or I could get 1 round of chemo. And I'm going to pay it because I don't have a choice. This is my life. Cancer survivors every day fight for their lives to be able to have the opportunities to just minimally. I'm fighting to be in my house, be alive, and to possibly have the opportunity of a future. And I'll do anything for that.
So tell me a little bit more about your advocacy for paid family and medical leave during this time and about your experience talking with your members of Congress about it during the recent Hill Week?
So paid family leave, like I said, I equate it with giving us basic, being able to give us the opportunity to figure out how we're going to function in this new world, in this new normal. An opportunity, because we're not fighting, we want to work, but we also want to live too. We can't do one without the other. Paid family leave gives us that opportunity to figure out how we're going to function in this society. Talking to members of Congress was eye-opening for them to hear what I've shared with you all. And there seemed to be an understanding of all the different factors that play into why we can't now function in the roles that we have play in society, that we're all important people, that we take our work seriously. I would love to get back to my school children at the museum. I would do anything to get back to them. But I don't know if it's safe. I don't know if it's safe for me. When I walk in the door, will the accommodation be enough to protect me there? I don't know. And I think it creates again another safety net, how important our safety nets are for us to be able to provide us basic needs, to be able to at least while we figure it out, be able to pay our mortgages, our rent, food on the table, and the things that we need to take care of our bodies. Ultimately, it comes down to our safety. And we all deserve to be safe in the work that we do. Everyone does. We have so many, that's where our laws come into play. That's our norms and our social rules trying to keep everyone safe. And in this moment, cancer survivors and other people with chronic illness need that help from everyone to be safe. And this definitely plays a part in that.
Because even your museum is not open, but even if it were open, there would be you would have to really think about your safety and whether you felt safe there, because there are workplaces that are open that aren't necessarily safe enough for people with chronic conditions and people with compromised immune systems.
I mean, even at the university and higher education, everyone is still contemplating, can we house students, and can they be safe? Can we be safe in that environment too? I even contemplated, oh well, I'll just teach next semester and I'll be fine. But then you think about those students are living together like sardines. There's not enough room on a campus. I work at an urban university. It's not a sprawling campus. It's blocks of the city of Pittsburgh. And I don't know if 18-year-olds can understand that they can infect me and they can infect others, older people, and that we won't survive it. They may survive it. I mean, the data is showing that actually young adults in our county we're doubling every day our COVID rate. They're getting sick. And I just don't have faith in the ability for all of us to function how we want to function and to be normal. I think about at the beginning of this that everybody had this kind of understanding that we needed to protect each other. Everyone had an understanding of what it's like to be chronically ill, in my opinion. Worrying about things that I've worried about for forever. Germs, washing our hands, being more aware of other people, being socially distant. And now, 4 months later, healthy people are rebelling because they can't do it anymore. And I think about, I'm never going to get that option to not do it anymore. So it's just, I understand, but we need to be able to trust that the world is going to be safe for everyone.
Right. Yeah. And we need to do our part to help make it safe for each other. And it's unfortunate because it feels like people are just gotten tired of the restrictions, and it doesn't mean that it's over and that we're safe. And I think, and there's also, I think, a bias that young people are fine. And I think your story shows it's not necessarily the case. There are definitely young people who have risk factors that we all have to help take care of each other.
I went from being terrified of strangers to going on a daily walk so that I can learn how to see someone and not be utterly afraid. How to put my mask on quickly, how to just, like, literally meditation walks of just trying to be able to learn how to again function. And I don't know what my coworkers are going to be like when I go back. I don't know if they'll remember that I'm not the same. I work in an office with people my age, and they don't sometimes remember that I'm a little different than everybody else. Too. I mean, I think about too, every flu season, are my coworkers getting flu shot? No, there's no herd in my office. There's Veronika getting her flu shot because I know that everybody else didn't get their flu shot. And that's something that we deal with every year. That's not even pandemic level. That's just common courtesy. So it's definitely a lot to think of. And we as cancer survivors deserve a fair shake too. Everyone at some point needs help, and this is the moment where I'm pleading that we all recognize those in our lives that need this support.
I appreciate your advocacy. And I remember back during in 2017 when we were fighting to protect the Affordable Care Act, the efforts to repeal it. And your story was so compelling, and your willingness to share it and really help people understand why it's so important to be able to have this safety net and this ability for people to get insurance, even if they don't have employer provided insurance or they can't afford insurance. You did it. I remember you speaking at events with your members of Congress and sharing your story. And I don't know if that was the beginning of advocacy for you, but I was just so amazed by your willingness to share your story and how effective you are at telling it and helping connect the story to, really the policies that impact people's lives.
It was, and NCCS gave me the opportunity to do that. I had been to Stupid CancerCon, and had met you all, and really you gave me the outlet and the tools to be able to do the work that needs to be done. So I thank you profusely for that. I remember that first conference, you, Shelley, being up on the stage and talking about how you were presenting an app so that everyone had access to be able to call their members of Congress. That truly inspired me to do this work. At the time I was contemplating doing my PhD, I am in the process of obtaining a PhD in community engagement, and that was fueled by my desire to give back to the world for all the help that the world has given me. There's no way to go through cancer alone. You need a lot of support from a lot of different people. And this is a way for me to give back. I worry about my legacy, that so much has been given to me. What can I put out into the world that has meaning? What can I do to help the next person, the next cancer survivor? And the PhD has helped me to do that. NCCS has helped me to do that. And it's made me more aware of our basic needs that a lot of us take for granted. One of my projects in the PhD is I created a food pantry for my college students at the university that I work at. And because students are food insecure across the country. And those are the types of projects and things that I hope, my story that I hope to leave behind, so that someone else gets inspired to take the next step. It's really important to help each other. In Pittsburg, we talk a lot about Fred Rogers, and as an early childhood educator, we're very in tune to Fred Rogers. And
Otherwise known as Mr. Rogers.
yes, also known as Mr. Rogers. And at the museum, we talk a lot like Fred, like we knew him, like he was part of the framework of the museum that I work at as well. And he talked about being the helper, to look for the helpers. And in times like these, we definitely need helpers. Every one of us does.
Well, I am older than you, and I grew up watching Mr. Rogers and adore him. And I love that quote that he talked. I love when he talks about looking for the helpers. And you definitely are one of the helpers, Veronika. You are inspiring, and I know that your willingness to share your story makes a huge impact because it inspires people to want to do more to help others. I love what you said about giving back to the world. That's helped you, and you're definitely doing that.
Thank you, Shelley. I really hope so. I really hope so.
I like to end all of our interviews with a question about any silver linings that you see in this situation that we find ourselves in with this pandemic.
For me, silver lining, I have, as a young adult with cancer, I have been given the opportunity during this pandemic to further connect with other young adults in Pittsburgh. We are a part of a local organization, and we do Zoom chats, support groups twice a week for 2 to 3 hours. And I have, because the anxiety is unbelievable. But as a result, I've connected with all of them, young adults 18 to 39, with every type of cancer, all trying to figure out this world too. And I don't think I would be able to function without them. I'm so happy to be a part of that group and to support them, and they support me. And that, to me, I was a part of that group that met in person once a month, and I didn't go quite as much as I could have. And these last 4 months, we all know each other very well and our struggles, and the love in that group is something that I could not be without. And so I'm thankful for that. I'm thankful for being able to be a part of a group of young adults who are optimistic and hopeful, but also are too struggling to get through the day to day. I don't feel quite alone.
Well, that's wonderful. I'm glad you have that support network and that you provide support to other people. I'm sure because for the people who are, newly diagnosed or still in treatment, seeing somebody like you who's 7 years out and, has rebuilt your life, I think I'm sure that's an inspiration to them. So it's, the thing about support groups is you get a lot of support, but you also give a lot. And I think that online support groups have just really flourished during this time. So I'm grateful that you have that opportunity both to give and to receive support because it's so important right now.
Absolutely.
Well, thank you so much, Veronika, for joining us today. We are really grateful for you and your time and your advocacy. And we will continue advocating for paid leave for cancer survivors to help provide that level of support that they need, as you said, as they figure out how to live in this new situation that we're in when their job doesn't allow them to continue working. So thank you for being here and for all that you do.
Thank you, Shelley. It was a pleasure.
Thank you for listening, and tune in next time for more Cancer Convos. For more information about cancer advocacy, policy, and helpful resources for survivors, visit NCCS at canceradvocacy.org. To find resources on COVID-19 and what cancer survivors need to know, go to canceradvocacy.org/COVID resources. You can follow NCCS on Twitter at Cancer Advocacy and on Facebook at Cancer Survivorship.